The next chapter now, we are going to see the complications, the consequences, the complications of diabetes. Do we know them? Let's try to see them together. Again, we are trying our best possible to make medicine easy, to make medicine so simple that everyone can understand it. And again, I'm requesting kindly health professionals who have knowledge about these conditions to come on board and share the knowledge, educate ourselves, educate our families, educate the communities so that we can make a difference. The knowledge that is not utilized is useless. Let's try to use the knowledge here. Let's come together. African Motion, group of health professionals. I have some colleagues that I work with, the nutritionists, physiotherapists. You are going to see many presentations that are coming in the very near future. But I'm calling everyone who is willing to volunteer to share the knowledge so that we put it available to everyone, to the communities, to our countries, particularly in our Africa, which is still behind as we know. We know that. So, diabetes part 4, we spoke about this organ, very important organ, pancreas, that is very useful in the body, and we saw what is diabetes, we saw the signs and symptoms, we saw the risk factors, but let's see the complications. If diabetes is not treated, if diabetes is not controlled, what are the complications? Do we know them? If you have diabetes, you have a family member, you have a neighbor whom you were told he or she has diabetes. Do we know the complications if it is not controlled? Please take this message, share this video to him or her, and see if it can bring a difference to someone's life. So let's see now the consequences or the complications of diabetes, which is not controlled. Diabetes is a chronic disease which can be managed. Diabetes, once it is controlled, I'm assuring you, there are no complications. If it is controlled, forget about complications. If it is well controlled. Now, to understand it, we saw that diabetes has it's a problem of the sugar metabolism, the problem of sugar utilization in the blood vessels, in the body, in the muscles, in the brain. If the sugar is not well utilized, it will cause problems. So this is a nice picture showing us blood vessels. Very nice one. This is a big vessel, which will give a bigger 2 branches, left and right. Then it will give other small branches, but it will end up by giving smallest that we call capillaries, the small blood vessels. That's how they get spread all over the body. Now, if the sugar is too much, is above the normal range, is above the reference value that we are supposed to have, the sugar becomes toxic. It will become toxic to the vessels. So this is how they behave. This is a sugar. It will start now behaving as if it's a knife, busy cutting the vessels inside. This is in the vessel in the lumen. So it will start cutting one vessel one by one. So if the time is longer with that damage, the complications will be more serious as well. If you have too much sugar as well in the vessels and the sugar is not utilized in the wrong place actually, then the problem may be more serious as well. This is how we need to understand it. Medicine made simple. Now, go today, take a sweet if you want to understand what we are trying to refer to. Take one of them, put it in the mouth, put in the cheek, and keep it for just 1 minute. You just keep it 1 minute, then after you take it out. After you try to take a mirror, check in the cheeks, check left side and check right side. check where the sugar, the sweet was deposited, and check where it was not. You will realize that where the sweet has been for 1-2 minutes, it becomes like eroded. You find there is a color change, or you find something like small wounds. Now you can imagine if that happens in the mouth, what would happen? Sugar in the blood vessels. We know the blood vessels inside, it is so soft, more than in the mouth. So we can understand the impact, the power of sugar. It can cause erosion on the soft part of the vessels inside. The other way, the aggregation of protein, the sugar that has been there for a long time, it will cause the hemoglobin, the collagen, they will start getting the attachment to the sugar, which will cause serious problems as well. Or it will cause what we call accumulation of sugar on some parts of the body, including the nerves, the one which help us to feel, and or lens of the eye. If this deposition of this salt now, of this sugar, they will cause problems where they are deposited. Or it can cause alteration of proteins. The protein will not function well. Or start producing what we call cytokines. Cytokines will be the product which causes inflammation. It's like the chemicals that could really burn the body, if I may call it. Osmotic effect, we saw that the sugar does attract water, and you're going to urinate in the previous presentation that we saw. Activation of protein kinase C. These are the different proteins that we find in the body that once they are badly utilized become toxic. Oxidative stress, oxidation, then the toxins become too much in the body. Or you try, because now we spoke about the deposition of this sugar, which are deposited on the nerves, then it will interfere with the conductivity of the information. The information that is normally, when you touch something, you touch water, you know that this is water. Even if you close your eyes, you touch fire, you know this is a fire. Information will move from the hands to the brain. Now, if now the nerves which help on the sensation are damaged or are interfered with the sugar, then the conductivity of the information will be interfered. The glomerular filtration rate will be damaged. That's in the kidney we are talking about. To understand it again, let's see this capillary. We know that the blood which comes from the heart will be sent to other parts of the body. Now, if these parts, the terminal part of the body, the vessels, the capillaries are damaged, knowing that they are the ones supplying the vital organs, we can understand what's going to happen, organ by organ. If we go to either the brain, the eyes, the heart, the kidneys, the skin, the vessels, the small vessels that are feeding these organs, once they are damaged, once the sugar has been cutting them inside, this is what would happen. One, you have either long-term complications, long-term. There are those which will come on a later stage, especially on the microvascular, the nephropathy, the problem on the kidneys, retinopathy, the problem on the eye, on the retina, the back part of the eye, which helps to fix the images, or neuropathy, the problem of the nerves that we spoke about. Or we get what we call macrovascular. Microvascular for the small vessels, but also the big vessels can be damaged. Cardiovascular diseases, peripheral vascular diseases, the bigger vessels can be damaged as well. But there is a long list of parts of the body that can be damaged. We spoke about the eye, the kidney, infections will start. We saw it in the complications. Vascular, cardiac problem, and kidney, which is together with this nephropathy. Food, because it has a terminal vessels, you get a lot of infections in the food, which are very severe. With leads to many people losing their limbs. Most of amputations are done because of infections that come from the foot. The skin is get infection, get poor healing of the wounds. This is very bad complication that we notice with this diabetes, which is not controlled. Now, there is something that is very painful when it comes to the diabetes. We are talking about the complication on the eye. Diabetes is the leading cause of new cases of blindness among adults. If you go to the people who get blindness today as we speak, the majority of them, are because of diabetes. That's why they say diabetes is the leading cause of blindness. So if the blood sugar is not controlled, the diabetes is not controlled, then we are having this risk of what? Of blindness. It becomes worse if it is combined with high blood pressure. So you can see that about 50% of patients with diabetes type 1 will have the retinopathy as well. Type 2, you might even notice diabetes. You might have this type without knowing. You just need to test and find you have it. So, or you might get somebody who presents with blindness, and when you check, you find that you have diabetes. So these are the complications we need to understand. But let's see organ by organ now. You see the eye. The eye is a very important organ that helps us to see. There is this lens, there is a pupil where the image has to go through, going to the retina to capture image sent to the brain for interpretation, and each part, whether the lens, where the retina inside, can be damaged. This is what happens. The lens we're talking about is this, it can be damaged. If it is damaged, then it will block, the image will not go through. We can see a lot of vessels are there to come to feed, to give proteins, oxygen, vitamins, so that the eye can function normally. Now, if these vessels are damaged, you can see what happens. Just very few vessels are still fine, but the majority of them now are damaged. Now you see edema, a lot of clouds, there is like a cotton wool now that we can see. We can no longer, there is no image that will be ever fixed on this retina, the back part of the eye, the complication on the eye. You can see what it shows. You can form what we call aneurysm. The vessels get swollen and they're no longer transporting blood as normal, or they get heart accident, start leaking water, or hemorrhages, bleeding, because they get damaged. We saw there are knives inside the blood vessel. With the sugar becomes toxic if it is not controlled. We've seen the previous presentation, what are the reference ranges? What should be my blood sugar level so that I don't have these complications? The kidney, very important organ that is supposed to filter, to take the toxins out, to remove the toxins as they come down in the urine. You see, now there are small vessels in the kidneys, and there are small filters that you cannot see with eyes, but these filters will conduct all the urine and remove toxins, and the toxins will come out as the blood will return again from the kidneys going back to the heart. This is a vessel that will bring the blood to be filtered, and this is the blood which will go back to the heart. That's how it works in the kidney. So, if now in that filter, the small vessels of this filter damaged, for sure we'll have a lot of problems. Normally, the proteins, the vitamins, the sugar, all the important nutrients, the soldiers of the body, the blood cells, they are supposed to be retained in this filter. Only toxins which are too small should pass through this filter. They should come and come out. Filter, it is like this one. It should filter the toxins out and keep the important proteins, vitamins, blood sugar, and whatever the body is in need of should be retained inside. So once now the vessels are damaged and the filter is damaged as well, eventually start losing. That's why you can see proteins in the urine. You can see sugar in the urine. You can start seeing the blood in the urine. Those are the complications of diabetes if it's not controlled. Complications on the kidney. Complications are on all parts of the body. We spoke about the eye. The same problem can happen to the brain, where it will cause a stroke. It can cause a stroke on the heart. Diabetic foot, very bad souls that are poorly hearing, and they become aggressive, they grow faster, and they can cause losing the foot. Diabetic nephropathy, we saw it right now, and the big vessels can be damaged. Diabetic neuropathy, the vessels that are the wires, if I may call it, electric wires of the body that help to transport the information. They will no longer be transporting information as it is supposed to be. These are the complications summarized. You can see the cells we are talking about in a diabetic patient. These they evolve very fast. You start with an ulcer. Once you get infected, it will, in a very short time, affect the whole body. I mean, the whole foot that can even lead to amputation. These are the complications we are talking about. This is a neuropathy, the problem on the nerves. It starts by feeling like it is stuck. I mean, the socks. It starts with the feet. You can start feeling the feet going up as if you have socks or gloves. You know, once you have these signs, you will know, these are the complications on the what? On the nerves that we call it symmetric polyneuropathy. Many wires of the body which are responsible to feel. You start feeling what we call numbness. You feel tingling as if you are being pricked needles. You know, so those are the things that we experience once the blood sugar is not controlled, especially on the nerves. Very important to know this. And in summary, glaucoma is another way, it's another disease that can be a complication on the eye. Diabetic neuropathy, we saw it on the heart, the neuropathy, kidney problems, skin complications, the blood vessels will be damaged, the whole body. There is no single part that cannot be affected if the blood sugar is not controlled. So the very important part now in managing this diabetes is to try the best to control it. Erectile dysfunction, we are going to have this topic as a separate topic because it is affecting many people. It is affecting many people, particularly men. If you are diabetic between 20 to 24, you will see that six of them, 6 out of 100 will be affected by the complications of diabetes, especially on the erectile dysfunction. You have your wife, you love her, you go to bed, but you cannot do anything. It's very frustrating. And you can see that a man between 55 to 59, above 50% of them, you count 100, 52 of them will be having this complication just because of diabetes. It's not because of the man not liking you as a wife, okay? The man loves you, but it's just a complication of this diabetes because the vessels and the nerves are being damaged. So we are going to see in the next presentation, how can we prevent this problem? How can we treat it? Is it possible? I'm inviting you colleagues, friends, who can do anything about this to come on board and work together. Earlier, we saw the long-term complications. Long-term complications. There are also short-term complications, which are very serious. For example, we have what we call DKA, diabetic ketoacidosis. It's simply when the body has failed to capture sugar and utilize it. the body will have to make a plan B. The plan B for the body will go now to try to get energy from fat. So once now the body is trying to break down fat, the waste product will be very toxic. The waste product from fat will be toxic. How will you know that? One, there is a lot of sugar in the body which is not utilized. When you test, the blood sugar is very high. And the patient may go to what we call metabolic acidosis, because when you check what we call alkalinity of the blood, you see there is acid, especially acid which is produced because of using the energy from what? From fat. You see what you call ketones. A lot of ketones, the degradation product, the toxins that are supposed to go out of the system, they are too much, especially after the degradation of fat. Then we check the urine, you see ketones inside. If they check blood sugar, they find a lot of blood sugar. The sugar is very high. They see pH, which is alkalinity of the blood, is very high. They check ketones in the blood. The ketones are very high. And when you check urine, you see there are ketones. That will tell now this patient is in DKA. Very important, DKA. So this is an emergency. It's an emergency situation where if this patient is not helped, we will go to coma. Coma very soon, because these are toxins that can kill the patient. So it's an emergency that needs to be taken care of. It's one of the short-term complications of diabetes. Others we saw, they were long-term. This is a short one. It's an emergency. The patient needs to be resuscitated as soon as possible. So how will you know that somebody has a DKA? You see the restless, patient will be dehydrated, drowsy, or will be confused, is in dizziness, or you will be breathing with that ketotic breath. You have the toxins from degradation of the fat. You can smell it from the breath of the patient. Abdominal pain, anorexia, and you will start now. We will see that there is what? Infections. The patient might have infection which triggers the rise of blood sugar, or ischemia. Ischemia, we spoke about the blood vessels, the getting affected, especially on the heart, on the brain, or intoxication, or the patient has missed insulin. This is how you will know the predisposing factors. You know, if you have infection and you go to decay, now we understand. The person develops decay because of what? Infection. Ischemia, lack of oxygen in the vessels, particularly on the heart, on the capillaries, which can lead to infarction, the blocking of the vessel, and that part which is fed by that particular vessel will get necrotic. Or the patient was intoxicated, different types of toxins. Insulin, the patient who's on insulin and for unknown reason he's missed his dose, which can predispose to decay. So we need to understand this. One of the complications that we cannot neglect is what we call fetal macrozonia. We say that in the previous presentations that there are three types: type 1, type 2, and this gestational diabetes. Gestational diabetes, as there is a problem of utilization of sugar to the mother and to the baby as well in the abdomen, when the baby is still inside. So the baby will consume a lot of sugar, and the baby will grow big, that can reach 4 kilograms to 5 kilograms in the abdomen. And the baby, the insulin did not cross the placenta to go to the baby. So the baby does not have insulin to manage that sugar. Then the baby starts growing bigger and become big macrosomia. And what the time now the baby is born, if the head manages to pass through the pelvis to come out, but the shoulders will not come out. If the shoulders do not come out, it's a serious complication to the baby and to the mother. Sometimes the baby comes out flat, the baby can die. If no intervention, this can kill the mother as well. So if you are diabetic, you know you are pregnant, please go to hospital regularly. Never miss your appointments. It's very important to prevent these complications. Majority of, actually all of them, should be done cesarean section to remove this baby and help the mother and help the baby immediately after birth. Thank you very much for following the presentation on the complications. The last part we are going to see will be on how do we prevent this condition? How do we treat it? Is it possible? Thank you so much for following. Welcome for the last presentation that is coming soon on the diabetes. Thank you.